Hello, everyone. I'm Brenda from DeSci Latam. And Tristan, please introduce yourself. Tell me about who you are and what are you doing and which project are you working on.
My name is Tristan Roberts. I've been supporting DeSci for many years before DeSci was a thing, and I was working in biotech for a gene therapy company, and now I'm looking at how to apply crypto to scale that venture.
Okay. And you have been one of the winner of DeSci Bangkok. So congratulations. I want to know more about your project. What is your project? What is the mission of your project? So can you tell us?
Yeah, I'm hoping to run a decentralized trial looking at longevity for dogs and improving that using a gene therapy that produces follistatin. Decentralized trials have been around before crypto, but they're really hard to run because people will sign up for the trial, they receive the treatment, and then they disappear. And so it's hard to know how much you have to recruit for your trial, and it's hard to get them to show up because of that. I think that we could use a staking mechanism so that people stake some sort of cryptocurrency at the beginning, and then once they submit their data 6 or 12 months later, they get some of that crypto back, or possibly even they get some equity in the form of tokens for that project.
Okay, so and right now, in which step of the roadmap of your project are you?
Right now, I'm
Or
seeking out clinical partners and investors. I've been working in the DeSci space as a connector for a while, but I finally feel like the community has grown enough that it's time for people to start doing things.
okay, so and I would like to know your vision about this side at the moment, at right now, at the present.
At the moment, we're seeing groups come together to work and fund new research, but I think that's just the start. I'm really excited about new ways of validating therapies outside of existing clinical studies. They're very expensive, they're very time consuming, and for many treatments that maybe the patent is expired or it's a different use of the treatment, there's almost no way for them to prove that it works because they can't get the money to do it, and so many treatments just die. Besides that, I'm also very excited about supply chain. There's a lot of areas that are underregulated, such as supplements and nootropics. And right now, it's really hard to know, is this good? Is this pure? Should I be putting this into my body or not? And so I hope that we can have ways of using decentralized identity and reputation, so that way when we buy things, we know that it's probably legitimate.
Okay, and how can improve this side?
How can we improve it?
Yes.
I think we need to get people using it. I think that the next big technology that we needed was zero knowledge proofs. We needed to be able to retain some amount of privacy. We don't always want to have everything be transparent on chain, but we also need identity and reputation to mature a little bit further. I think we're starting to see decentralized identity develop. And if once we have that, we can do so many more exciting things.
Okay, so one of the biggest challenge for us, for the community, is to reach scientists and bring them to Web3. So if you can give us an advice from scientists, how can we reach them? How can we bring to this part of?
This is a big problem, and some people have been thinking about making a decentralized journal or whatever, but I think the scientists will come to where the money is. So that if we are able to show that they're able to get grants and funding in a way that's much easier than the existing processes, then they will come over to DeSci, and then we can potentially fix the journals and some of the other institutions that surround the scientists.
Okay, and my last question, can you uh, give give us your vision for the next 4 years about this side? What is going to happen? How? we are going to grow up.
Yes. I think that if we continue to see some of these new technologies develop, we're looking at identity, reputation, zero knowledge proofs, and collective data ownership. If we see those things develop, then we can potentially create an entirely new system, a parallel system to the existing biomedicine system. And so, to put it in more specific examples, the scientists could certify the producers of a therapy. The producers certify the distributors, and the distributors certify the end consumer. And when you go to buy something on the internet, you can look at that chain of certifications and see that it links to the scientists that you trust. And that way you have more confidence that this is legitimate and not fake product. And now, as a verified consumer, you could put your data into some sort of online ledger, some sort of crypto ledger, and now we have all of these verified reviews from people actually using something. And that will hopefully help us have more knowledge and truth around rare treatments or treatments that weren't able to get funding.
Thank you. The last thing, can you share an alpha or maybe an advice to the community? Could be an alpha from your project.
What's really exciting about DeSci projects is that as soon as they release data, then the token might gain value. So it's important to follow the researchers that are involved in these DeSci projects because as soon as they publish something, it's time to make a decision.
Okay. Thank you so much.
Okay,
Um, so
cool.
say,
Thanks for
and
having me.
yes, and the last thing, can you share us your social media? How can we find you?
Sure. On Twitter, formerly known, well, okay, sorry, on X or on Twitter, it's Aetheric, Aitherick. You can also find me on Telegram with the same handle.
Okay, okay. Thank you so much.
A pleasure.